My name is Sani Roy. I'm a native of the DFW area, and I joined the Cook Children's family as a pediatric endocrinologist in 2016. Soon after I joined Cook Children's, I met a young boy with Prader-Willi syndrome, and in caring for him, I realized the extreme complexities of his condition and the many gaps in his medical care. I learned that there was no program with expertise in Prader-Willi syndrome in all of North Texas and even in many of our surrounding states. Prader-Willi syndrome, or PWS, is a rare disease, and yet it is the most common congenital obesity syndrome. It's a condition that affects nearly every organ system in the body. To have the best possible health, children with this condition need to see several medical specialists and receive many types of long-term therapies. It's a condition that can become very overwhelming, both for physicians caring for children with this condition, but most importantly, for families and caregivers. I am so grateful to have received an Endowed Chair from Cook Children's in 2022 to develop a comprehensive program for management of children with PWS. With the generous support of Cook Children's, we were able to develop and open the multidisciplinary Prader-Willi Wellness, Education, and Research Center, known as the Empower Center, in 2022. The acronym of our program is EMPOWER, as that is truly our goal, to empower our patients and families, clinicians, institutions, and community through wellness and health, education, and research. Our Empower Center has numerous dedicated clinicians and staff who are passionate about our patients with this complex condition. We have families who visit our center from all over Texas and from surrounding states. Analysis of our first-year data showed that our families actually saved an average of 495 miles of driving time from seeing 4 physicians on 4 separate days. We are so humbled that each of our families entrusts us with the care of their child. Beyond development of our Empower Center, the Endowed Chair program has been instrumental in providing me with time and support from our incredible Cook Children's Research Department to build a research program. Our research team is leading and collaborating on several pivotal research projects in the PWS community. In February of 2024, we published a large study investigating feeding tube use and complications in patients with PWS using data from the Global PWS Registry. The results of our study were compelling and will likely play a key role in how neonatal ICUs decide whether to place a feeding tube in children with PWS, and if so, which tube to place. Our center received a generous research grant from the Foundation for Prader-Willi Research in 2024 to study another critical clinical question in the PWS community through a multi-site study, specifically the role of growth hormone therapy in sleep disturbances in babies and young children with PWS. In early 2024, we opened our first PWS clinical trial at Cook, and we are so glad to be able to offer our families the opportunity to participate in studies like these to help find medications that we hope will make life much better for our children with PWS. This is just the start. We have many other research studies underway to help answer several important clinical questions for children with PWS. Beyond PWS, we hope to expand our impact on an even larger scale. We are working on developing a model for multidisciplinary care that we believe will be helpful for clinicians and institutions who also aim to develop multidisciplinary models of care like we have done here at Cook Children's. Several of our team members have taken on leadership on the state or national level for PWS. We have plans in the coming years to continue to advocate for, educate, and empower our patients and their families. We could not do this important work without the grace of God and the support of this Endowed Chair program and Cook Children's. We are very grateful to be able to help fulfill the Cook Children's promise for our patients with Prader-Willi syndrome.